Good day, folks. Thank you for joining us here at Your Health. On today's program, we will be taking your calls for the entire hour. I'd love to talk to as many of you as possible. So with that in mind, let's go to our news. Let's see what's happening in the health world. Taking blood pressure medication before bedtime reduces the risk of developing adult-onset diabetes. Researchers from the University of Vigo, Spain, followed over 2,000 hypertension patients at risk for diabetes for 6 years. Half of the study subjects took their blood pressure medication first thing in the morning. The other half took their medication before bed each night. They found after 6 years, those who took their blood pressure medication before bed had lower nighttime blood pressure. They also found those who took their meds at night showed blood pressure patterns that more closely resembled patients without hypertension. And remarkably, those who took all their blood pressure medication at bedtime were at 57% reduced risk of developing diabetes. The study was published in Diabetologia. The results of this study defy conventional wisdom, folks. Doctors have been recommending their hypertension patients take their blood pressure medications first thing in the morning in hopes of keeping pressure down during the morning adrenaline and cortisol surge that we all experience. This study finds we should be doing just the opposite, taking our blood pressure meds right before bedtime. They found when we take them at bedtime, our nighttime pressure is lower with a blood pressure pattern that resembles non-hypertensive patients, meaning the bedtime takers experienced a normal drop in nighttime pressure that morning takers do not. But the big finding was the bedtime medicine takers, after 6 years, 57% less likely to have developed adult-onset diabetes. It is important to disclose all of the study subjects were taking either ACE inhibitors, ARBSs, or beta blocker medications for their blood pressure. There are, of course, other types of blood pressure medications, and we cannot assume it's best to take the others at bedtime since they were not studied. But for the ACE inhibitors, ARBs, and the beta blockers, nighttime dosage appears to be best. I strongly recommend if you have hypertension and you're taking one of these types of medications, discuss with your doctor whether nighttime dosage would be best for you. It could help you avoid diabetes. That'd be a good thing. Teaching preschool children the basics of a healthy lifestyle translates into better health and lower risk of obesity. Researchers from Spain developed a health education program for 3 to 5-year-olds. The program involved their schools, teachers, and parents. It sought to expand their knowledge of a healthy diet and the impact it would have on their bodies. The program also provided for frequent opportunities to exercise outdoors. They followed the children and their families' progress for 3 years. They found the children that received extra health training had a greater health knowledge, a better attitude towards healthy foods and healthy lifestyle traits. They also found the children that received the 3 full years of health education had a significantly lower body fat percentage. The study was published by the American College of Cardiologists. Well, folks, this is a major change in approach to disease from the American College of Cardiology. The America's heart specialists are experts at treating all forms of heart disease, and we would be in big trouble without them, but they are not the ones we depend on for knowledge about how to prevent heart disease. The authors of this study state, with the growing numbers of obese and diabetic patients, the world's heart specialists will be overwhelmed with patients if we do not act now. They're implementing plans now to help children learn more about the ways of good health. And this study proves that taking a little extra time with preschoolers to teach them the basics pays big dividends, and it does so quickly. The American College of Cardiologists are planning more studies to better understand what works best in educating youngsters, but you know enough now to make a positive impact with your children and grandchildren. For example, providing simple explanations as to why we eat vegetables, because they make us strong and resistant to disease. Simple tidbits like this go a long way with kids, as they are like little sponges, absorbing all of our wisdom. Those who drink diet beverages compensate by overeating unhealthy foods. Researchers from the University of Illinois evaluated the dietary patterns of over 22,000 subjects. They found those who drink alcohol or sugar-sweetened beverages consume more calories overall. However, those who drink artificially sweetened drinks compensate by overeating unhealthy foods with higher levels of sugar, salt, fat, and cholesterol. The study found fully 90% of all the study subjects regularly consumed non-essential discretionary foods, such as cookies, ice cream, chocolate, fries, and pastries. Folks, another recent study found that today, we eat about 700 extra calories every day compared with 1971. This current study helps us to understand what types of foods we're overeating and even perhaps why we eat them. Now, I have noticed, as I'm sure you have, whenever I drink a diet soda, I become hungry, and I usually eat more the next meal. How about you? Have you noticed that? I now know to avoid these artificially sweetened drinks. The occasional treat is fine, but not every day. This study uncovered some interesting facts. Those who regularly drink alcohol consume 384 extra calories every day. Those who daily consume sugar-sweetened drinks eat 226 extra calories. Coffee drinkers, 88. Diet beverage drinkers, 69. And tea drinkers, 64 extra calories. But the diet soda drinkers, well, they consume disproportionately more junk food with a high salt, sugar, and fat content. Some experts believe this pattern is emerging because artificial sweeteners cause inflammation and low blood sugar levels in the brain, compelling us to eat more. Now let's make this as practical as possible. Our preceding study proves the merits of educating children about the benefits of living healthily. With this bit of knowledge about diet sodas, we can now explain to the little ones why drinking them regularly is not a good habit to develop, because they make us eat more and make our brains feel bad. It really is all about knowledge, isn't it? Today on Your Health, we will be taking your calls for the entire hour. Please join us. I'd love to talk to you. Be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
Bioinnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Welcome back, everyone. It is such a blessing to be with you today. Well, just as Richard promised, we're going to be taking your calls the entire hour today. Today's show is all about you. Pick up the phone and dial 800-635-2673. Get in line. If you have to wait a little bit, please don't hang up. Stay on the line. I'm sure you'll get through. Well, let's go to Indiana now and welcome Julia to the show. Hi there, Julia.
Oh, hi, I feel like weeping. I'm so glad to talk to you. I'm so grateful for Becker's Betterment program.
Oh, well, thank you for the kind words, Julia. How are you doing today?
Terrible, thank you.
You're something. Tell us about your troubles, Julia. Maybe we can help you.
I hope so. I have two major things I wanted to ask you, and then I've got all kinds of problems. I've been 22 years old 4 times.
Okay, 22. So that makes you 88, correct?
Right.
All right.
Okay. The other day, you were saying that people with low thyroid, which I have, should be careful about vitamin D, but you didn't explain how I should go about that. I don't like missing my vitamin D.
Well, Julie, I think that's a misunderstanding.
Oh, good.
Yeah, because people with low thyroid, they need vitamin D like everybody else. Now, there is one condition, it's called hyperparathyroid. In hyperparathyroidism, we need to lower vitamin D levels because both can raise calcium in the bloodstream. But that's not you. That's a completely different organ. The parathyroids sit on the thyroid gland. In location, they're very similar, but they do completely different things, okay?
Okay.
So how much vitamin D are you taking?
Well, I was doing 5 a day.
That's good. That's good.
And then I quit. However, yesterday I took 3 anyway.
May I ask how much you weigh, Julia, the approximate weight?
You shouldn't ask that.
I know,
175.
but... Okay, 5,000 is what you need.
Okay.
5 to 6,000 is good for you. 5 is good. That's good for you. Tell me, what you said there's another area of trouble. What was that?
Yeah, I had 3 bad falls in a row, and I landed on the knee, bent my nose sideways, kind of.
Oh, my.
But the knee has spurs on it now.
Oh, my. Okay.
And is there anything that I can take to dissolve spurs?
Well, spurs occur for a variety of reasons. If there are asymmetrical tensions in the body, we can develop a spur, and the spur is an attempt to strengthen a ligament or tendon, and it becomes calcified to increase its strength. If we can return symmetry to the stresses of the body, it helps. Imagine an example. One leg is an inch longer than the other. That sets the pelvis off. It creates stresses and tension in our body, and that can lead to spurs. Does that make sense, Julia?
That.
So your spur was a result of trauma. One of the underlying themes of spurs is an imbalance of calcium and magnesium. Do you supplement calcium or magnesium, either one?
Well, once in a while calcium, but I do the magnesium.
There are several things I think we can do to help you, but I'm more concerned about these falls. Why are we falling? Is the vision compromised? Or?
I am toddly. You know, I have to hang on to things.
Okay.
But those times, the one time in particular, I have a little tiny step down in my living room. And I was wearing I have lost height, and I didn't realize I'd put on this old nightgown, and it was too long, and I tripped on it.
Well, you know, these are the things we need to be very careful with. The whole idea, Julia, is to maintain your independence, correct?
Right.
You want to maintain your independence. So
I'm still trying to hang on to that and live in my home.
I don't blame you. I think that's what we should do. So this means the hallways are well lit. The pathway to the restroom in the night, you can see very clearly. There's no throw rugs. There's no extension cords. Everything has its place. It's free and clear. Minimize the steps. If that step's a problem, have somebody come in and build a ramp down. So you don't have to take a stamp. It's a gradual ramp instead of a step. Does that make sense?
It do that.
These things all make a difference. They'll
Yeah.
keep you independent and on your own.
I am trying to be careful that way.
Well, good. We have to take care of ourselves. There's another area that may be of help to you. We know that people who supplement vitamin D, we've talked about that with you, and also B12. Vitamin B12 supplementation helps to reduce the incidence of falls. It keeps our nerves strong. It keeps our balance system in better condition. Vitamin D and B12 both are critical for nerve function and balance and brain function. So let's get you a little vitamin B12. You take a little sublingual under the tongue. You're taking your vitamin D, 5,000 a day. I want to send you a bottle of vitamin D as well. Also, to help with the pain, the spur, a little noni juice can be very helpful for that, and a product called Bone Up. And I like Bone Up because it is the proper blend of calcium and magnesium. If we can get the magnesium level up to where it needs to be, it helps to dissolve these spurs over time. It takes time. And, you know, we have to be patient with that. Sometimes the surgeons will go in and cut those out, but I don't think it's that bad, is it, Julia? That you'd want to have an operation on it? Yeah, that's what she's trying to do.
Too elderly.
Yeah, you're trying to avoid the operation. So the Bone Up, take 4 or 5 of those pills every day, and then let's give you a little magnesium gel to rub on the area. You know, there's one last thing I'd like to send to you because it helps the arthritic pain, and that's boswellia. Boswellia is the biblical herb frankincense. It is a special substance. It helps to calm the inflammation of arthritis and bone spurs. Taking 1 or 2 of those a day with an ounce or 2 of noni, I think you'll be impressed how much better and how it relieves that pain. What do you think of that, Julie? Are we on the right track for you? Is there anything else?
Wonderful. I haven't mentioned my eyes.
Oh, okay.
I have lost my driver's license because I can't pass the test.
Okay. Well,
what can I do for that specifically?
Do you think you should be able to drive? Are you in a state where you can handle that?
Oh, I think I wouldn't go very far anyway.
Yeah.
But it bothers me not being able to leave my house in case I need to.
Okay.
I don't have any trouble with driving.
I can't promise you that taking carotenoids would restore your vision so that you can pass the test, but we know that taking the carotenoids, lutein, zeaxanthin, this type of thing, it does help to improve vision. Noni juice has been known to help with the vision too. So one of the carotenoid tablets, or it's actually a gel cap, take one of those every single day with the other nutrients, and let's see if it doesn't help you. All right?
The other thing was,
okay.
you said 3 things.
Yes, well, they'll be in a package. You'll have them. You'll have noni juice, Bone Up. That's for your calcium and magnesium.
I mean for the eyes. You said 3 things.
Yeah, it's the carotenoid. It's the package. It's a pill. It's a gel cap. It has the diverse carotenoid molecules. Oh. It'll all be obvious to you when you get the package, okay? All right. We have important messages, folks. We'll be back in just a moment. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker for your health at a glance. Are you looking for a way to lower your risk of Alzheimer's? As the prevalence of obesity and metabolic syndrome continue to increase, researchers have found a possible link between type 2 diabetes and the onset of Alzheimer's disease. In fact, type 2 diabetics are at 200% higher risk of Alzheimer's compared to people without diabetes. These metabolic changes that develop with diabetes appears to greatly increase the speed of deterioration of the brain and other related systems. Lowering your blood glucose is easier than you may think. Eat smaller meals, exercise regularly, and reduce carbohydrates in your diet, especially simple sugars. Taking steps today to control your blood glucose may protect your entire body, including your brain. For your health at a glance, I'm Dr. Richard Becker. There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone. Let's go to South Carolina now and welcome Christie to the show. Hi, Christie.
Hi.
Hi, Christy. How are you today?
I'm not doing the greatest.
No?
But I'm here.
Tell me about it. What's going on?
All right. I'm a 35-year-old mom of 4 children. Back in June this year, I felt like I thought I was a healthy person until one day I went out to lunch and I was eating this food from a Japanese restaurant, and I kind of got sick a little bit in the stomach, and I started having a bad burning in my stomach.
Okay.
And from then on, I couldn't eat for a while. I think probably about 2 weeks I didn't eat. I was just drinking. I lost like 20 pounds.
Christy, slow down. With this food, did you develop diarrhea or vomiting, anything like that?
I had diarrhea.
Okay.
No
Do you think it's
vomiting.
possible that you got food poisoning?
It could be.
Did you have raw fish? You said sushi. I think raw fish. Raw fish can have contaminants very easy. When you don't cook the food, it can be contaminated. What do you think?
No, it wasn't raw fish. It was.
Okay. But you could have,
rice.
you either had some type of immune reaction, like an allergic reaction to the food, or there was a pathogen in the food. You had diarrhea for several days. You lost weight. That's very typical. Go on, continue.
Okay, and so from then on, I started developing these all kind of crazy symptoms. I got chronic fatigue, tingling in my extremities, muscle spasms, muscle pain, and this like weird off-balance dizziness that I've had ever since then.
I have a couple questions. How long after your last childbirth did this hit you? How long?
My daughter was 3 years old.
3 years old, okay.
Yeah.
Did you go to a doctor for any of this? Did you?
I have. I've been to a lot of doctors, and I've also been to a few naturopathic doctors as well. I've been told adrenal fatigue, and then they had me on supplements for my adrenal glands.
Christy, slow down.
Okay.
You saw a bunch of doctors. Did they do laboratory tests?
Yes, sir. I got blood work done, a lot of blood work.
What did it show? What are the conclusions from the blood work and the diagnostics?
Blood work shows everything is great.
Well, that can't be right.
Yeah.
Let's talk about that for a minute. Folks, there are thousands of blood tests. You go to the doctor, you know you're sick, things are wrong. They do 15, 20 different blood tests. Those are all normal. Does that mean you're wrong, you're fine, or does that mean they didn't do the right tests? It's one or the other. How is it for you? You're still sick. just because your blood tests don't show any abnormalities doesn't mean there isn't another blood test that would show abnormalities, correct? See, this is a problem people have all the time. I go to the doctor, I've been feeling bad for weeks, they do blood tests, they're all fine, doctor says, you're fine. No, you're not. They didn't do the right tests. What do you think of that? Am I nuts here? Or could this be possible?
That's very possible.
Yeah, okay,
like
all right. So you did the blood tests, everything appeared fine, but you know that's not true. There are problems. What's the next step? Tell me more.
Okay, and well, I did have a chest X-ray done. They checked my my chest and everything. They said
All that
was
looked
fine.
normal. Okay, so
that
this
looked
led
normal.
to some therapeutics. Have you done some things to help yourself? What have you done to help yourself feel better?
I've changed my diet. So
Okay.
right now I'm on a Candida. I'm doing a Candida diet to because I haven't
Yes.
really been checked for Candida. I did like a home test and it did come out positive. Like I did like a little spit test
Yes,
and
okay.
it came out positive. So I did change my diet to a Candida.
Has that
diet.
helped you any, Christy? Has it helped any at all?
I've only been on it for 5 weeks, and I mean, I don't feel a whole lot better. I feel I have a little bit more energy, but not. I still don't feel normal. You know what I'm saying?
Are you taking any vitamins, supplements, medications, anything?
I'm taking nystatin. I was prescribed nystatin.
Okay.
And I started that. I've been on it 5 weeks, and I started.
How much are you taking?
I'm taking 2. I started off at 1 pill 3 times a day, and now I'm up to 2 pills 3 times a day.
Are you still having diarrhea or loose stool?
No, I haven't had any diarrhea or loose stool.
Okay. So what symptoms remain? How do you feel now?
I feel really like weak and the dizziness and a lot of muscle pain in my body.
Do you take vitamin D?
I was taking vitamin D.
When?
Let's see, it's been about maybe a month ago. I was taking it, and then
Yeah, but you weren't taking vitamin D when all this happened. When you went out to eat and all this trouble started.
No, I wasn't
you weren't
taking it
vitamin.
then.
Okay.
No.
All right. Well, what do you think's going on? What do you think, Christy? It's important that you have in your mind an image of the problem because, you know, if we want to fight the foe, if we're going to war, the generals all tell you, you must know the enemy. If you are sick, you must know what's making you sick or how in the world can we get well. You know, we can't just take every supplement and every drug. We can't do that. We need to narrow this down. What do you think is wrong?
I'm praying that it's the Candida problem, Candida overgrowth, and after I finish the treatment, I'll feel better. But other than that, I'm thinking...
Have any of these doctors given you a diagnosis? Did they say, I think you have this, 1, 2, 3?
No, I haven't really gotten a real diagnosis. Except for they did say gastritis in the beginning when I had the stomach burning, but that was just kind of I think that was more of a guess because I haven't been to a gastroenterologist or anything to look inside of my stomach.
One last question, and I'll tell you what I think you should do. How is your weight, Christy? Where are we at with our weight?
I lost 20 pounds when I first got sick. I was at 160. Now I'm down to like 140.
Okay. All right.
And I haven't really lost any more weight since the beginning when I got sick.
Well, due to the fact that, you know, all the tests you've had come back normal, this is very common with the yeast candida syndrome. We see this all the time. Here I see, this is what I think is probably happening to you. And before I go into that, I want to say, you know, sometimes we have to leave our community to get a proper second opinion. Sometimes we have to go to the medical school at the university in the big city. Sometimes we have to do this. Sometimes we have to travel. We have to seek out second opinions and get a comprehensive diagnostic workup. Sometimes that's absolutely necessary in doing what we're doing. Now, this is entirely possible that you have contracted food poisoning of an allergy to the food you ate. It greatly disturbed the intestinal ecosystem. When this occurs, we develop what's called dysbiosis. It's the whole foundation of the book we wrote here, Foundations for Healing, is dysbiosis and how it can lead to chronic fatigue and all these problems. I want to send you my book, Foundations for Healing. It'll help you understand Your Journey to Better Health. With that book, I want you to take some astragalus. It'll help. What happens, folks, when the dysbiosis occurs, chronic viruses pop up. That's the chronic fatigue. It's cytomegalovirus, Epstein-Barr virus, herpes virus can come back, and that keeps you in a constant state of illness. So we've got to build the immune system up and suppress these viruses. Astragalus will help you do that. Vitamin D, magnesium, and curcumin. L-lysine inhibits the replication of double-stranded DNA viruses. That's Epstein-Barr virus and herpes. Vitamin C, taking 4 or 5 grams every day will help you do this. The medicinal mushrooms improve the immune response. It'll help you to fight these germs off. Probiotics, probiotics, probiotics. Eat kefir, yogurt, buttermilk. Do it every single day. Oil of oregano. Cut back on that nystatin a little. With the help of your doctor, I can't change your medicines, but you're going to get some intestinal irritation with chronic nystatin. Oil of oregano doesn't do that to you. That and a little fish oil. Stay with your diet. I think you're going to start feeling better soon. We have a break. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega-369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today. Welcome back, everyone. Well, if you are just joining us, we are taking your calls the entire hour today. So pick up that phone, dial 800-635-2673. Well, let's go to Louisiana now and welcome Jackie. Hi there, Jackie.
Hello, this is Becker.
Hi.
Jackie, how are you today?
Well, I have only one complaint. I'm doing pretty good. I'm 70 years old. I weigh 125 pounds.
Okay.
And I went to bed one night and woke up. My face felt tight. And I thought I had a stroke, and I went to the doctor. He said I had Bell's palsy.
Oh my goodness. Okay.
And it's been over a year, and it hasn't. He told me it could go away, and then you might not ever go completely away. But everybody that I talked to that said it's gone. And I still have a little of it with the speech problem, and I can't smile completely.
Right. Well, Jackie,
I've used different vitamins. Everybody tells me something different.
Mm-hmm.
Yes. Well, let's talk a little bit about Bell's palsy. Bell's palsy is a condition where the facial nerve swells, and the facial nerve comes out by the jaw here, and it comes through bone. So this soft nerve goes through hard bone, and it comes out and it innervates most of the face. And when we have a paralysis of that nerve, you'll have ptosis, which means you can't quite close your eye and it droops, and there's a frown and you can't bring this side of the mouth up. So we call this Bell's palsy. Now, if the nerve swells dramatically and it gets pinched in the bone, it can actually damage the nerve. If it's not too bad of a scenario and it's not severe swelling, you get a little drooping, and in 4 to 6 weeks that clears up and you're back and you're fine. Now, the question has to be asked, why does this nerve swell? What happens? Because it does act like a stroke, and it scares a lot of people, and it sends them to the doctor thinking, I've had a stroke, and you do this big workup. No stroke, it's Bell's palsy. It'll either go away or it won't go away. Well, that's not good enough for me. I like to improve the odds so the patient gets return of the facial nerve function, and they can smile again and close their eye. Because, you know, if you can't blink your eye properly, it will dry out, and it can lead to all the way to vision loss, corneal scarring, and that's just a mess. We don't want that. Well, recently, scientists have found what happens in the majority of Bell's palsy patients is a herpetic virus, a type of herpes virus, gets into the nerve ganglia of the facial nerve, and it causes this swelling. And so this opens the door for a potential therapy for Bell's palsy. We would treat it the same way as you would cytomegalovirus, Epstein's-Barr virus, which causes mono as a child, and chronic fatigue in adults. So what can we do to help this? And I can't promise you, Jackie, the nerve function's going to come back, but these are the things that have been shown to help inhibit these types of viruses and calm down the swelling so that maybe the nerve can return. Do you want to try them?
Yes, I do.
Okay. Well, first of all, eat as healthy of a diet as possible. You know, citrus is really good. Vitamin C is good for this type of thing, and we want you to feature a very healthy diet. The next thing is curcumin, the spice. Curcumin helps nerves function better. I don't have time to go into all the details on curcumin, but I would take at least 2 of these gel caps every day for curcumin. L-lysine is an amino acid that is found in milk. We're going to concentrate that L-lysine and take higher doses of it. A gram once or twice a day. L-lysine, the herpes-type viruses need a specific ratio of lysine to arginine to replicate. And we can manipulate that ratio by taking L-lysine. It's perfectly safe. You're not going to have any trouble with it. And then that virus can't replicate. If it can't replicate, your body's immune system can catch up and suppress this virus. Next thing is astragalus. Astragalus does the same thing for the cytomegalo type of virus. And it's very helpful for people with chronic fatigue and immune suppression. And this is, you have a little micro version of that. So a couple astragalus capsules every day can be helpful for you. The medicinal mushrooms. Medicinal mushrooms contain beta-glucans. They activate the immune response. This is, in essence, an immune-based disease. If your immune system weren't reacting in such a way, you wouldn't have swollen. If your immune system could fight the germ off better, you wouldn't have had this situation in the first place, because not everybody gets Bell's palsy, but everybody's exposed to these viruses, and I mean everybody. So we want to improve your immune response. The medicinal mushrooms will help with that. I know this seems like a lot, but we're trying to return a paralysis back to proper function. Next is vitamin D. You should be taking 5,000 units every day. Well, let's see, you mentioned 120 pounds, that's about 4,000 for you. And I recommend everybody get your vitamin D levels checked. It's the best way to guide your therapy. Some people can take 1,000 units and their blood level goes all the way up to 80. Well, if I gave that person 5,000 units, they could go into the toxic range. Now, those people aren't common, but it does happen. That's why it's best for everyone to get their blood level tested with vitamin D and use that to guide your therapy. But in general, the dose is from 4,000 to 7,000, depending on what size you are and your obesity level. Let's have you take 4,000 international units a day. One other thing, and that is Boswellia. Boswellia, we mentioned it earlier, Boswellia is the biblical herb called frankincense. And not only does it smell nice, you know, when I open the bottle of Boswellia, I take a sniff and boy, that does smell good. And it is the most common ingredient in frankincense, or incense that is burned today, but it also works medicinally when we take it inside. It calms inflammation, it helps arthritis, and it's going to help the swelling of that nerve. So we implement this program, give it some time, and see if that nerve can't regenerate. Now, you have to be patient because the nerve can replace itself at the rate of about 1 millimeter a day. 1 millimeter a day, so it takes time to come back and to reinnervate all the facial muscles. But with time, maybe that will help them for you. We have a break. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
For many of us, the days pass on by. Whether it's living for the weekend, waiting till the kids come home, or waiting for whatever is next, don't waste your life waiting on tomorrow when there is still today. Benjamin Franklin said, "Do you love life? Then do not squander time, for that's the stuff life is made of." The Lord did not give us today to sit and wait on tomorrow. What we do today shapes our tomorrows. As David wrote in Psalm 90:12, "Teach us to number our days, that we may gain a heart of wisdom."
Different people have different vitamin and mineral needs. That's why Dr. Becker's Bionutrients multiple vitamin and mineral powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, Bionutrients has a multiple vitamin that's just right for you. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. We're back. Let's go to Oklahoma now and welcome Michelle to the show. Hi, Michelle.
Hi, Cindy. Thank you so much for you and Dr. Becker having me on today.
Oh, it's our pleasure. How can we help you, Michelle?
Yes, but just in the last 6 months, I have been diagnosed with autoimmune hepatitis.
Okay.
I have a lot of extreme weight loss that probably within the last year. You know, I normally weigh around 128, and so I'm down like to 92 pounds.
Michelle, I
yes.
need to understand, did the weight loss come after the diagnosis or when you started feeling bad, or were you trying to lose weight and then it ended with this autoimmune hepatitis? How?
No, yes, no, I was not trying to lose weight. It's just been in the past year. I just started losing weight, and you know, I thought, well, you know, something, you know, had to be occurring in my body.
Michelle, are you experiencing diarrhea or food intolerances?
Not diarrhea. And every once in a while, you know, I do maybe with an irritable bowel have, you know.
Okay.
But not always diarrhea, no, sir.
Not daily diarrhea, but your intestines could use some help. Yes?
Yes.
Okay, continue.
And just along with my weight loss, the doctor said, you know, along with that, the autoimmune hepatitis, you can have a lot of joint pain. So I've been having a lot of joint pain, mainly even in my right arm, to where I do not even hardly have a lot of mobility as far as, like, you know, putting my hand around towards my back.
Michelle,
yes.
How do you know we have autoimmune hepatitis? What tests were done to come to that conclusion?
They did a lot of blood work, and they said everything pointed to all of my blood work pointed to autoimmune hepatitis.
Did they do a liver biopsy?
Now, that's one thing that we have to.
Have they done a gastroesophageal duodenoscopy, an EGD? Did they look into your stomach and small intestine? No?
No, they have not done that.
Okay.
They have scheduled a biopsy for me on the 16th of October.
Biopsy of the liver?
Yes, sir.
That's not a bad idea.
Okay, I've just kind of been putting that off because I don't
blame you.
Sure.
I don't blame you, because the liver is a very delicate organ, and it sometimes we have trouble controlling the clotting. Sometimes.
Right.
I don't want to scare you because we do what we have to do, but you have to know what can go wrong, and that's part of it. What do you think is wrong? Now, I get it that the doctors have diagnosed autoimmune hepatitis, but we need to figure out why you're having this. Do you have any ideas why you're in this pickle?
I really don't. Probably like a year and a half ago, I'd had like extreme stomach problems, and I went to the emergency room, and they did some blood work and come back that they had found like H. pylori in my system. So I don't know if that started everything off.
I doubt it.
But,
what kind of work do you do?
Waitress.
Have you been exposed to any heavy metals, toxins, poisons? Do you live right next to a farm? Have you ever been sprayed with pesticides? You know, any kind of poisonous exposure?
No, sir, not to my knowledge.
Not to your knowledge, but you know everyone in America is exposed to poison on a daily basis. Everyone.
I believe that.
We eat, you know, every bite of corn you eat, every bit of wheat, rice, soybeans, unless you're eating organic, has been saturated, sprayed with pesticides. That's how it is in America today. And unless you eat organic, you get it in every bite. And that's the kind of stuff that leads to autoimmune hepatitis.
Okay. Now,
But there's another thing that could lead to this. Has anybody ever asked you or questions about tested you for celiac disease? Reactions to gluten. Have you been tested for celiac disease?
No, I haven't.
Well, I wish you would. This could explain everything about you. If you have celiac disease and you continue to eat wheat, barley and rye, but primarily wheat, that's the big one, the protein component of wheat called gluten, you'll end up with a liver transplant, and if you don't stop eating wheat then, you'll lose that liver too. I don't know you have it, but I have a suspicion that is the core root problem for you. Wouldn't this be amazing if all you needed to do was eliminate wheat, and within 6 months, you're running marathons again? Wouldn't that be wonderful?
Oh, absolutely, yes.
Well, there's some other things I want you to do, but if no doctor will test you for gluten sensitivity, just quit eating gluten altogether. That's not the best way to do it, because if you are truly celiac, you will have a lifetime of avoiding wheat, and you need to know exactly why you're doing that, and a positive test is very helpful. The gold standard is the EGD, the scope and the biopsy of the duodenum. That's the gold standard, but you can do it through blood too. And I think the gold standard of the EGD is because the gastroenterologists like to do the scopes, and they make a living doing that. You can do it through blood. You can do it through blood. But you need to be on vitamin D. I'm going to send you some. These are things to help your liver. Vitamin D, 5,000 units every day. Alpha lipoic acid, sustained release, 300 milligrams, 1 every 8 hours, 3 a day. Cordyceps sinensis. It's one of the best herbal therapies we have for liver conditions. I would take 8 a day, 4 in the morning, 4 in the evening. Milk thistle, 2 in the morning, 2 in the evening. Next, eat 4 Brazil nuts every day. Why? Because they contain selenium in an amino acid blend, the most absorbable form of selenium. 4 of them a day. Probiotics, every day is yogurt, kefir, sour cream, buttermilk, and probiotic supplementation. And then avoid the gluten. I want to send you Foundations for Healing. I think we found the reason for your problem. Please get the test. Start the program for recovery. Good luck, girl. We have a break. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
Bioinnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. Your Health is brought to you by Bioinnovations, trusted products for your health and well-being. We're back. Let's go to Michigan and welcome Tiffany to the show. Hi, Tiffany.
Hi, Cindy. Hi, Dr. Becker.
Hi, Tiffany.
Thank you for taking my call today. I've just recently been diagnosed with a pleural effusion and stage 2B aggressive ovarian cancer.
Yes, ma'am.
And I'm just trying to find out what supplements I might be able to take to combat this cancer and the chemo side effects.
You've been through a lot, haven't you?
Yes, I have.
Do you feel like the chemo was failing you?
Well, it's still early on. I'm already dealing with a lot of side effects, neuropathy,
Oh, poor girl.
fungal infections, rashes.
Yes. Tiffany, have you been afforded any nutritional therapies at all through your program?
They've recommended vitamin D and B complex.
That's a start. That's a start. I don't have time to go into all the details, but I understand your diagnosis, and believe me, I understand your challenges. So I'm going to send you this stuff. This is going to make a difference for you. Inositol and IP6. Inositol is one of the parts of fiber that lowers the risk of cancer. And we've done a lot of, scientists, we have read it and understand it, and we're helping you to understand it. Inositol is involved in cell signaling. What that means is when you ingest it in your diet, or when you can make enough of it, and cancer patients don't make enough of it, it turns on your immune response to help you kill off this cancer. Because chemotherapy is not what cures people. It's your immune system. Chemo beats back the cancer enough so that your immune system can clean it out. That's the essence of it. And inositol, IP6 will help you to do that. The medicinal mushrooms are in the same vein because they have beta-glucans in them. And these beta-glucans are another fibrous component that turn on the immune system. And this is not a type of turn on of the immune system that autoimmune disease has. This is a normal amplification of what your immune system is capable of doing in a healthy way. All right? Next, indole-3-carbinol. Most ovarian cancers are hormone-driven. Indole-3-carbinol helps to modulate the hormone response. That is in your interest. Vitamin D, absolutely. And it's imperative that you have your vitamin D blood level assayed. Shoot for a 70 to 80 nanogram per deciliter blood level. 70 to 80 nanograms per deciliter. That's your target. And that will probably take about 7,000 to 8,000 units daily. Tiffany, how much vitamin D are you taking?
I think it's only 1,000.
That's not anywhere near enough. Not anywhere near enough. I'm going to send you a nice good bottle of vitamin D so you can take enough. For you, I would take 20,000 units every day for 5 days. Get your blood level up. Yes, you heard me right. 20,000 a day for 5 days, and then go down to your 7,000 every day. Okay? Next, probiotics. Every meal has a little probiotic in it, whether it's a little yogurt. If you don't want to have the fermented dairy with every meal, take a probiotic with every meal. Oil of oregano to calm the yeast down. You are full of yeast right now because chemotherapy kills off your normal bowel flora and yeast proliferates. We need to keep it under check. Noni for the aches and pains. Active Adult Multiple Vitamin Mineral. This will replace your B complex and it'll give you your other vitamins and nutrients and calcium and magnesium and all the trace minerals and a little bit of the amino acid supplementation so your body can keep making blood and all the things you need to have. CoQ10 and curcumin. These will help spare your nerves and your heart from the ravages of chemotherapy. What else? A little grapeseed extract and resveratrol. These helps to protect the brain from the effects of chemotherapy. I also want to send you Foundations for Healing. Read it all. Read everything about it, even the sections that aren't dealing with cancer. And I want to send you a book that may just lift your spirits. It's Beating Cancer with Nutrition. You'll read about others who have conquered this dreadful disease with nutritional therapies, giving you hope and courage to continue in your battle. Hang in there, dear. You are in our thoughts and prayers.
Right.
Time is short. Thank you for your kind attention, folks. We'll see you tomorrow.
Thanks, everyone. Bye-bye.
Did you know lifestyle diseases are a $2 trillion economic burden annually? Benjamin Franklin once said an ounce of prevention is worth a pound of cure. Don't wait for a diagnosis, disease, or other ailment to surprise you. Eat an apple, take a walk, give a hug. Take positive preventive steps towards a healthier lifestyle, and you'll experience vitality every day. It's not crazy, just healthy.
Hi, my name's Charlie. Have you ever tried to watch your favorite CTN show? Only to find out you already missed it. Aww. Well, I've got good news for you. Hooray! You can catch all your favorite shows on YouTube. And just by a few clicks. So, what are you waiting for?